Well, good morning, everyone. It's great to be here at Shoppers Drug Mart, Sherway Gardens. I want to thank Jeff Leger, the president of Shoppers Drug Mart, for everything they're doing to help our battle against COVID-19. Pharmacies are absolutely vital in our provincial vaccination plan, as they put thousands of needles into people's arms across Ontario every single day, along with mass vaccination sites, mobile and hospital clinics, and Operation Remote Immunity. Pharmacies are helping us to quickly ramp up capacity to put this awful pandemic behind us. Thanks to the efforts of the people in the pharmacy and the army of frontline healthcare heroes and volunteers, we're getting needles in arms even faster than we could ever imagine. I want to thank General Rick Hillier for his leadership in getting us to this point. I also want to salute my all-star colleagues, Minister Elliott and Solicitor General Jones, along with MPP Christine Hogarth. You've all moved mountains to get us to where we are today. And we've made incredible progress in getting more COVID vaccines to our most vulnerable. As of yesterday, over 50% of all Ontario residents aged 80 and over have received their first shot. In fact, yesterday was a record day. We administered over 61,000 doses, bringing our total COVID-19 vaccines to over 1.4 million doses. That's more than any province in the entire country, and it's truly remarkable. Because of this progress, I can now say we're ready to take the next step in our vaccine rollout, and we're able to do so ahead of schedule. Starting this Monday, March the 22nd, we will accept appointments for residents 75 years of age and older. This is an incredible achievement. It shows what we can do when we unleash the full power of Team Ontario. So far, we've vaccinated more than 91,000 people through our drugstores. And in the coming weeks, we will have about 700 pharmacies offering vaccines all across the province. And folks, to put the 700 into perspective, that's less than 25% of our capacity on drugstores. That's hundreds more. As we bring more pharmacies on board, we're expanding who they and primary care clinics offer to vaccines. Effective Monday, pharmacies and primary care settings can begin booking appointments for individual aged 60 and over. As they do, they will honor all appointments currently booked. But we won't stop there, and we can't stop there. We want more pharmacies. We want mass immunization sites running at their full potential. We want as many people vaccinated as quickly as possible. Just think about what we could do with a steady supply of mass vaccines from the federal government. Today's announcement makes one thing clear. We have the infrastructure in place and we're ready. All we need is certainty and a steady supply of vaccines. For those over 75 or friends and family supporting them, please start booking your appointments starting Monday. I'm going to repeat that, Monday, not today, but Monday. For everyone else, please be patient as we get more supply. Your turn is coming. Thank you, and God bless the people of Ontario. Now I'll hand it over to the General.
Premier, thank you, and ladies and gentlemen, good morning, and thank you for listening here this morning. We are in a good place, as I had the opportunity to brief the Premier yesterday with the vaccination rollout in Ontario. As of tonight, we will cross into 1.5 million vaccines into the arms of the people of Ontario. As the Premier said, yesterday we had more than 61,000 vaccinations just in one day alone, and today we'll do even better than that. We have mass vaccination clinics that have been opening across the province this week and continuing into next week to give us several hundred who can get those vaccinations into the arms of the people of Ontario as quickly as we get the vaccines. We've utilized the pharmacies in the pilot project in Kingston and Toronto and Windsor, Essex to proof the system for using first AstraZeneca and then Moderna in the pharmacy chain. And again, as the Premier said, we have some 300 plus pharmacies in that pilot project right now, vaccinating people in the age of 60 to 64 with AstraZeneca. In the next several weeks, we want to more than double that to 700. And in the couple of weeks after that, we want to double that again to more than 1,500 and bring really a measles sheet when you look at a map of Ontario, of vaccination sites across this province so that people can have an opportunity to get a vaccine very close to where they live. And between those mass vaccination sites, the pharmacies, family doctors, mobile clinics and pop-up clinics and in-community clinics, we will have a large number of vaccination sites right across the province in every single area where people will live. Our online booking system and customer service desk went live on Monday. And yes, in the customer service desk, we had a surge of calls, and there was a wait time in the first half of the day. But by afternoon on Monday, the wait time was down to just minutes. And on Tuesday, Wednesday, and yesterday, the wait time was down to seconds, and in some cases with no wait time whatsoever. You phoned, and somebody answered the phone and helped look after you. It was a wonderful system, and I commend the people who put it into place and thank them for their great work. The online booking system went live on Monday also. As you know, in the last 5 days, we booked more than 300,000 vaccination appointments across the province of Ontario for people to get the vaccine and for us to be able to offer them that level of protection that they so desperately need and we want them to have. That will continue. We have noticed that the number of people over 80 have declined in booking the appointments, and that's why we now are obviously ready to go to booking appointments for those 75 years of age and older. And in the pharmacies with the AstraZeneca that we have, with what we know is coming, we know that we can get at a greater group of the people in the population, and therefore going from 60, not just to 64, but from 60 upwards, we can bring AstraZeneca to the people who are eligible for it and who want to get it very, very quickly indeed. So the vaccination program is rolling. When I came to Ontario at Premier Ford's request, he asked me to advise on the allocation of the vaccines. We did that. He asked me to advise on the priorities, and the Government of Ontario has directed the province into which priorities we will use, starting with our most vulnerable, which we've been working at, continuing through the healthcare workers, those professionals who look after all of us all the time, not just during COVID-19 itself, and then continuing through really what is a focus on age and risk. Those priorities have been clear. He asked me also to advise on the distribution, both logistically of those vaccines and operationally. In other words, how to get them out and get them in the arms of the people of Ontario, and we have done that. We briefed him on Sunday morning, and after that briefing, the Premier had two comments. He said, "This is excellent," and the comment he also made after that was the one he just made here this morning. He said, "We're ready." And I said, "Mr. Premier, my mandate is finished. It was till the 31st of March. I'm here until then. We'll continue to work at it, but really the system is set up. It's ready to go. And the hundreds and hundreds of people who work to put that system in place, and the thousands who support them and put needles into people's arms, they've done incredible work, and I just want to compliment them and thank them for the work and set that system up and got it rolling. We're ready. 61,000 vaccines yesterday. We'll do more today. One of the days next week, we'll be into 100,000 plus vaccines into the arms of the people of Ontario per day, and we'll continue to build that capacity based on the vaccines that we get coming into the country. And I'll stop right there. Thank you.
Well, thank you, General. Folks, I'll tell you, we've been fortunate to have the General. What an absolute champion, but we're set, we're ready to go, and as he told me, he's always on standby, but he's done an incredible job. So the people of Ontario, thank you, General.
We'll go to the phone line for questions. First question, please.
Your first question comes from Brian Lilly with the Toronto Sun. Please go ahead.
Hi, Brian.
Good morning, Premier. I think I just spoke to my mother a little while ago, who will be happy to hear this news. Wanted to ask you, though, about the issue of lockdowns. And I know that you've got a cabinet meeting coming up later today. You've got a lot of different opinions coming your way. Our front page today is Dr. Karim Kurdi of York Region saying that lockdowns are not the answer anymore. But you've also got the science table saying that we should have a stricter lockdown from Oshawa to Niagara, the curfew for Toronto. Dr. Lowe in Peel and Dr. DeVilla in Toronto say modified gray. So you say that you want to listen to the doctors and the science. Which ones? Because you've got multiple competing views. Do you agree with your science table that we should have a stricter lockdown and a curfew in Toronto and shut down the schools for the next 3 weeks?
Well, we'll make that announcement later today. We're going to meet as cabinet, make that decision, Brian. I got to give a shout out to Dr. Kurji. That guy's incredible doctor. I had a good conversation with him a couple nights ago, and he's doing an incredible job. Talk about a true leader. You see what they're doing in York. They're moving at a rapid speed, so he's doing a great job. I've always, from day one, taken my advice off Dr. Williams, and we look forward to taking his advice, and we'll make a decision at Cabinet.
Follow-up?
The issue of looking around at how other jurisdictions have handled things, British Columbia has had restrictions in place since the beginning of COVID, but they haven't had the ongoing rotating lockdowns that we have. The restaurants have remained open with restrictions, same with retail, same with kids' sports, and yet they have lower cases per capita of COVID-19 than Ontario, and their death rate is just a little above half of what Ontario's is at on a per capita basis. Have you asked your team to look at what Dr. Bonnie Henry is doing and what might be working for the greater Vancouver area that isn't working in the greater Toronto area?
Well, we're kind of comparing apples and oranges. Toronto's 3 million people with a surrounding area of GTA of another 3 million compared to a much smaller city of Vancouver. So we have a much denser population here. But Brian, I hear you loud and clear. There's no one out there that wants to open up businesses more than I do, and vast majority of the places are open, to the exception of restaurants and a few other areas. Believe me, it drives me absolutely crazy about closing businesses. But in saying all that, we have another variant. I'm taking the advice, which I always have, off the Chief Medical Officer, and I'm going to continue to take the advice off the Chief Medical Officer. But I'll pass this over to Minister Elliott there.
Well, each province is doing things differently. We're doing things that Dr. Williams and the team believes and makes recommendations to us that are in the best interests of Ontarians. But what we're really doing is it's almost a race against time for us to be able to get as many needles into people's arms as possible to protect people and keep them safe as the variants of concern continue to grow in Ontario. Unfortunately, they're about 40% of all cases of COVID right now. It's more transmissible, results in more hospitalizations, more people in intensive care, and unfortunately more deaths. So we have to still be very cautious. This is still a very precarious time, but with the great rollout of the vaccines and the fact that the pharmacies are offering them and can offer them now to people over age 60, that's going to really help us in the fight against COVID, and then allow us in time to be able to open more things up. But right now we have to be very cautious.
Next question.
Your next question comes from Laura Stone with the Globe and Mail. Please go ahead.
Hi, Laura.
Good morning.
Yeah.
Happy Friday.
Boy, you seem peppy today.
I just wanted to clarify the AstraZeneca shots for over 60s.
Yep.
Why is the province choosing to focus on that age group for AstraZeneca, 60 plus? And are the shots available all at pharmacies all over the province, or is it just in those select groups? I guess I'm just trying to figure out,
Sure.
If I'm 75, where can I get my shot on Monday?
Yeah, so what you can do is you can go to one of the 700 pharmacies that are going to be open. Come to a Shoppers that are open close by, and you'll be able to get your shot. So it's really filling that gap from 60 upwards, and the mass vaccination centers are going to be focusing on 70 plus.
Follow-up?
Okay, thanks. And
Yep.
And I'm just wondering, I'm wondering why the province wasn't able to open up appointments for older adults sooner. We've seen, for instance, Quebec has given a majority of its vaccines to seniors, and Ontario has not done that. So Minister Elliott just said it's a race against time. So I guess the question is, I think a lot of people are wondering, why hasn't Ontario been able to move to the older population faster?
Yeah, well, we're moving like grease lightning, and everyone wants to compare us to either BC or Quebec or wherever they want to compare us to. The bottom line is We're kicking butt out there. We're vaccinating more people than anyone in the entire country. We could have taken a different approach, and Quebec took a different approach. They wanted to vaccinate their long-term care patients, which is a fraction of the amount of long-term care patients that we have. So far, we're the only jurisdiction that has given double doses to close to 300,000 long-term care patients and the people that work at long-term care. So Quebec decided not to. They rolled the dice. They thought one shot would be good enough. I didn't want to chance it, with the situation we're facing, and I think it's paid off in dividends. We've seen the mortalities in long-term care drop drastically, and as I said yesterday, 1 or 2 are too many. Some days are 0. Yesterday was 0. That's what I'd like to see. I'm just not chancing it with long-term care. So we're doing a spectacular job. We're moving like greased lightning, as I said, and we're going to continue moving. All we need, I'm going to go back to this again, we need vaccines. And let me explain what just happened with this Moderna. And I was saying this yesterday, how the goalposts are constantly shifting. We're expecting 323,000 Moderna next week. Surprise, surprise. So we get all geared up, ready to go, 323,000. And I can't even begin to explain the logistics and the infrastructure that has to be put in place when you make a decision. And surprise, surprise, we aren't getting it. We're getting 91,000, and the balance will follow the following week. So we're constantly trying to shift and keep up. And in saying that, we're doing a spectacular job. All the pharmacies, the mass vaccination centers, we are at a fraction of the capacity. Once we unleash the full capacity, as the general was briefing me the other day, if we opened up everything full tilt, we could do as high as 9 million a month. I'm talking 3,200 pharmacies, 233 mass immunization centers, the hospitals, the mobile units. Bring it on. We need the vaccines. We're ready to go. But you can't give us quantities and then switch them and then go back and forth. It creates a big problem for us.
Next question.
Your next question comes from Mike Crawley with CBC News. Please go ahead.
Hi, Mike.
Hi, Premier, and it might be Minister Elliott who wants to respond to this question. We're hearing from hospitals that as this third wave is hitting, they're starting to see younger people coming to ICUs and being hospitalized with COVID-19. How concerned are you about the trend that seems to suggest that the third wave could actually hit younger populations harder than what we saw in the first couple waves of the pandemic?
Well, we are seeing that the variants of concern are striking more younger people, and we're following that very closely. We're also watching the capacity in our hospitals as well, because we know that if the variants of concern increase exponentially, we're going to need to have medicine beds, we're going to need to have more intensive care beds, more ventilators, but we're ready for that. We are ready for an upswing. We are working to contain it so that doesn't happen, but we're ready for that too. We're ready for any increases. But with the vaccination program underway, we're, again, as I said before, racing against time to get more needles in more arms, and that depends on a consistent and steady supply of vaccines that we need from the federal government, and in very large quantities, because we're ready to go with that. We can triple, quadruple the number of vaccinations that we can put into people's arms if we have the supply. So that's what we're working on as well.
Follow-up?
The General mentioned that the reason you're able to move to the 75-year-old and up age group starting on Monday is because the number of people aged 80, you've noticed that the number of people aged 80 and up booking appointments has actually dwindled in the last couple of days. So are you concerned that the sort of overall, what are your concerns about the overall coverage that you're getting for vaccinations in that age group? What sort of percentage are you aiming for? And are you feeling that it's actually adequate to, that enough people are signing up to actually provide adequate protection to the population as a whole?
Yes, the response has been amazing. People have been calling in to get their appointments. Now they'll be able to get them through pharmacies as well if they wish to get the AstraZeneca vaccine. But we have vaccinated a high percentage of people over 80, and we also have appointments made for them. So we know that there are other people coming in that are over 80. So we feel that it's time now to move to age 75 because we want to keep putting those needles into people's arms, and we're continuing to receive those calls.
Minister Elliott, thank you. And can I say those appointments will continue for the 80s and over. We've got them booked out several weeks, but what we're following is the trend on bookings itself. And as soon as that starts to decrease below the capacity that we have and the vaccines that we are anticipating, then obviously we want to move to the next age group because we don't want to have a single day with seats empty that we otherwise could have filled. And that's why we want on Monday to go to 75+ 75 and plus booking their appointments. But in many cases, those appointments will be a week or 2 weeks or 3 weeks away even. In some cases, to be able to get them early because each health unit across the province has moved at slightly different speeds, and that's a very, very good thing as they adapt to their own specific population. I'd just like to go back and just clarify again on the pharmacy piece. In the pilot project, which has been in Kingston, Toronto, and Windsor-Essex, we have had 327 pharmacies moving AstraZeneca for age 60 to 64. With the change in the NACI guidelines, with an increase that we see in AstraZeneca coming in, and with a decision to move Moderna into pharmacies a little bit down the road, in the next 2 weeks, we will more than double that from that 327 to over 700 pharmacies right across the province, not just in those 3 areas. We will have pharmacies with AstraZeneca right across the province in the next 2 weeks, more than 700 of them. And then in the 2 weeks following that, we'll double and more than double yet again to more than 1,500 pharmacies, again, right around the province. And they will be bringing AstraZeneca for ages from Monday forward, from ages 60 upwards, because we've adapted to the NACI guidelines and offer it to those people. And we have lots of AstraZeneca coming in, and we'll get those appointments and get the vaccine into people's arms. So in early April, we'll have more than 1,500 pharmacies with AstraZeneca, and then also starting to move Moderna and be able to vaccinate with that right around the province of Ontario. Thank you.
Next question.
Your next question comes from Robert Benty with the Toronto Star. Please go ahead.
Hi, Robert.
Hi, Premier. With this increase in the supply and everything of vaccines, are you concerned that some people are going to vaccination or vaccine shop? They're going to say, look, I don't want to get AstraZeneca because I've read stories of Europe, what's happening in Europe. I want to wait for Pfizer or Moderna. What are you going to do about that? And what kind of advice do you have to people who have concerns about some of these vaccines?
Well, first of all, Health Canada has approved this, saying it's safe. And over in Europe, they confirmed it yesterday as well, saying AstraZeneca is safe. I truly believe it's safe. For a second, if anyone ever told me it wasn't, any health professional here that I listened to, I'd pull it away in 10 seconds. I'd never jeopardize the health of anyone. But what I've heard from the docs, AstraZeneca and the other two, Moderna and Pfizer, if you take the shot, it's going to do 2 things. It's going to keep you out of the hospital, and it's going to save your life. So I would take their advice. Minister, do you have any comments?
Really, just to reiterate what the Premier just said, all of the vaccines that are offered in Canada now have been validated by Health Canada and also by NACI, that they have taken another look at AstraZeneca. They have approved it as being safe and efficacious, and as has the European Medicine Agency. So they specifically looked at it on the issue of blood clots and have determined that there is no causal relationship between AstraZeneca and that situation. So it is safe for people to take, and as the Premier said, it's going to keep you out of the hospital and save your life.
And if I could add just one last comment, as Dr. Robin Williams said to me several times now, the best vaccine is the one you can get right now. So if you're in that age group of 60 and above, and you get an opportunity to get AstraZeneca, as the Premier said, it keeps you from from going into the hospital, and it keeps you alive. Take the opportunity to get that AstraZeneca. It's a wonderful vaccine. And as Dr. Williams also said, if we ever got our flu vaccines, for example, to that level of efficacy, the medical professionals would be doing cartwheels in the street. So AstraZeneca is a very effective vaccine, and it's available for a different age group, starting at age 60 and above. It's going to be in the pharmacies, and you will be able to get it very quickly. And Pfizer and Moderna for those age groups may be a lot further down the road. So if you can get it now, I would commend that you get it now. It'll protect you, it'll keep you out of the hospital, and it'll keep you alive.
Follow-up?
Yeah, and with the booking system being open to people aged 75 and up starting Monday, which I think is about a week or two earlier than you had anticipated. When do you see people in younger cohorts who being able to use that, 70 plus, 65 plus, and so on, using the online portal, not just going to the pharmacies?
Thank you. Yeah, we're about 2 weeks in front in starting the reservations of 75 and above, and that's because of the number of vaccines that we have, the incredible efficiency of the vaccination clinics and putting that into the arms of people. And I happened to be at Unity Health yesterday watching the team there, incredible team of professionals there, vaccinating 80 and older people showing up with their daughters or their sons or caregivers, and the tender, loving care and the compassion with which they looked after those people was absolutely incredible. And not only that, they're efficient. They're getting the vaccines into the arms, and they're working through that population. So we got a little advanced because of that efficiency in the vaccines arriving. And 75 now, as you said, 75 and up, starting on Monday. If you're not 75 or above, please don't go on the call center. Please don't go online and book. All you're going to do is make it more difficult for those people to get appointments. 2 weeks or so after that, we'll continue to reassess, and we'll look at the numbers of appointments being made by that group 75 years old and above. And as soon as it starts to diminish below the capacity that we have in the next week or 2 weeks following that, then that's when we'll make the decision to go to the next lower age group. I'm guessing early April would be that decision time for the next age group. I'd love to be proven wrong in that one, but early April in the 70s. But we will continue to assess, and we do it based on the number of appointments being booked. That's what tells us 2 weeks out whether we're going to have our clinics full of that group or whether we need to step to the next lower level. So early April for the next group would be my estimate.
That's great. Well, first of all, folks, I want to wish everyone a very good weekend. You know, sometimes I tell personal stories, and today's going to be a personal story, kind of not about COVID, but I'm an animal lover. I absolutely love animals. My family loves animals. So I come walking out of the house this morning, and we have coyotes in our area. Up in Etobicoke, we have coyotes everywhere. But I walk out, and there's a big coyote outside the house, but he was injured. He was badly injured in the back right leg. And so he's kind of limping along, and he went down the side in between the houses. And I thought, boy, this thing's not going to make it. He has to hunt to stay alive, and I'm not going to have a dead coyote on my watch. So what I did is I talked to the mayor, and way to go, Mayor Tory. He's an animal lover like I am. And so the reason I'm reaching out to the media here, and I nicknamed this coyote Cody the Coyote. So anyways, if you see him, we can get animal services, call animal services. We want to try to help this coyote and get him fixed up. So sorry for the little animal story, but I got a big heart for animals. I can't let this coyote, go out there and, not be able to hunt. So anyways, that's my story of the day. Thank you. God bless everyone, and have a great weekend.
Thanks, everyone.